Hi, sir. Good evening.
Hello, good evening.
Sir, I have made you the co-host, sir. You can share the screen and start the class, sir.
Okay, just wait a while, right?
Yeah, sure, sir.
Is it visible, the screen?
Yes, sir.
Okay, just wait a minute.
Yeah, okay, sir.
Okay, we can start now.
Okay, sir.
Good evening, everyone. So welcome back to another live session of 90 Days University Prof Pre-Final Mastery here at Auricle. And so today we are going to discuss our next topic of our live session, that is ocular injuries. Okay, so what are the topics that we are going to study today? So we are going to study today about one long essay and six short essays. The long essays will include the classification of various types of ocular injuries, and we'll discuss blunt injury in detail. And we'll discuss six short essay type questions like traumatic hyphema, traumatic cataract, sympathetic ophthalmitis, corneal foreign bodies, calcosis, and Berlin's edema. So these are the topics that we're going to discuss today. Okay, before starting, let me just give you a brief introduction of what is Auricle and what services we provide you here at Auricle. So here at Auricle, we have recorded classes, we have live classes, we have practical sessions, we have rapid revision exam modules, and we have hard copy book set. So uh, recorded classes provides you flexible learning. Okay, it provides you flexible learning, and it provides you a convenient revision, and it is at your convenience that whenever you want to watch a video, whenever you want to study, or whenever you want to revise, you can just open up the app and you can see the video. So this is only made for your convenience, so that it provides you flexible learning. We also have live classes like this, where you can interact with your teachers on one-to-one basis, and it provides you in-depth coverage of the topic. And these live classes are taken by the expert educators, and it provides also interactive learning, and you can also clear your doubts as well in the live classes. And you have MCQ polls also, where you can check your understanding of the class. Okay, as I told you, we have express exam modules. These are mainly for your revision course, and this covers your entire syllabus in under 20 hours. And it mainly emphasizes on answer writing skills and the important topics which are very high scoring. And these are very interactive sessions, and it focuses mainly on exam strategies, right? So this whole syllabus, it gets completed in under 20 hours, and it provides you answer writing skills, and these are also taken by the expert educators. We also believe in one-to-one doubt clearing. We also have one-to-one doubt clearing session, which will help you to clear your doubts whenever you have one, so that it does not pile up. Okay, and this is very student-centric approach, and the personalized attention is given to the students for clearing their doubts, and it also creates a safe learning environment. Okay, as I told you that we also have hard copy note set, and this hard copy note set is specially curated for you with very crisp and concise notes written of important topics that have been repeatedly asked in your previous university questions, and also the other important topics. And you can also find a book of your practical exams. And this book is mainly written in a point-wise manner, and it's very colorful, because we all agree that we cannot just read each and every line of a textbook, because that will be very hectic, and it is not feasible also, right? So we have to just cut out some of the other things. So this notes is specially made for you. Okay. We also have question banks for practice sessions, and it can be customizable for your uh, convenience, and it can be at 3 levels of expertise, beginner to expert level. Okay, so it covers for all your 3 kinds of exams. For example, your prof exams, your NEET PG exam, and also your FMG exams. Okay. In the practical sessions, we also have practical sessions where the videos are made and it provides you hands-on experience and an in-depth covering of your practicals. Okay. And it also covers all your Bible questions that are commonly asked in your practical exams. And it gives you confidence and skill, which is needed in your practical exam, because practical exams also carry equal weightage as that of theory exams. So you should not miss the practical sessions. And if you want to excel in your practical exams. Okay, so we have 4 kinds of subscription plans here at Auricle. We have foundation plan, we have advanced learning plan, we have complete learning plan, and we have ultimate MBBS plan, right? So these vary according to the duration. Okay, so foundation plans for 3 months, advanced learning plans for 6 months, complete learning plan is for 12 months, and this ultimate MBBS plan stays with you throughout your MBBS journey. Okay, so if you want Auricle to be with you for the whole of your MBBS curriculum, then you can opt for ultimate MBBS plan. And if you want to subscribe and get an additional discount, you can use my coupon code, that is Dr.Raj 20 for additional discount of 20%. Okay, so let us start today's topic, that is ocular injuries, right? Okay. So ocular injuries. So we are going to discuss about the ocular injuries. So ocular means eyes. Injuries means the you can say how does our eyes get injured? Okay, injury as such, it is mostly it is not related to the infection, but rather it is due to the you can say, for example, like you got hit by someone, or there isn't some kind of accident, so that kind of injuries are classified as ocular injuries. Okay, so we'll discuss what kind of ocular injuries are, and how many types of ocular injuries are, what are the symptoms, what is the classification, how do we treat these ocular injuries, because this is a separate topic and it is frequently asked in your exam. So we'll discuss only the important topics that has been asked in your exams and how to write the answers. Okay, so first of all, the main question that is asked in your practical exams is classification of ocular injuries. Okay, so classification of ocular injuries. So what are the types of ocular injuries? As we can see, there are 4 types of ocular injuries. There are 4 types of ocular injuries. So there are blunt injuries, there are penetrating injuries, there are perforating injuries, and there are chemical injuries, right? Sorry. So we have 4 kinds of injuries. First is blunt injuries. Second is penetrating injuries. Third is perforating injuries. And the fourth is chemical injuries. Okay, so these are 4 kinds of injuries. Now, what do you mean by blunt injuries? Blunt injuries results from objects like fists or balls. So, for example, somebody hit my eyes with a fist. Okay, so what kind of injury will result? It will result in blunt injuries. Okay, it will result in blunt injuries, and it is the most common type of injuries. So, it is the most common type of injuries a person face. Okay, it results from the fist or balls, and it affects the internal eye structures. Okay, not a penetrating injuries. Penetrating injuries means something is penetrating inside your eyeball or inside your orbit. So it is caused by sharp objects leading to a full thickness damage to the eyeball. Okay, it's caused by sharp objects leading to full thickness damage to your eyeball. It will completely something, for example, a pencil. A pencil has been penetrated inside my eyeball. So that will be penetrating injuries. The name itself suggests that something is getting penetrated inside my eyes. Okay, so that are penetrating injuries. How about perforating injuries? Perforating injuries means something is perforating. Okay, results in entry and exit of wounds, often more severe. So this kind of injuries results in entry and exit. So there is an entry to the there's an entry to foreign objects, and there's an exit also to the foreign objects. Okay, so foreign objects can enter inside the eye and it can exit also inside the eye. So that means it kinds of creates some hole. It kinds of creates some track inside the eyeball. Okay, so that is not very usual and that is not very normal. Okay, so that is the perforating injuries. It results in entry and exit of wounds, often more severe. So it is a severe type of reaction. Okay, not chemical injuries. The name itself suggests something chemical is happening What is the most common chemicals? Acids or alkalis? So acids or alkalis leading to the ocular surface damage. Okay. It results in damage to ocular surface, for example, victims of acid attack. Somebody throw an acid in your eyes. Okay, so that will result in chemical injuries. Okay, we'll see what happens in injuries. Okay, so these are we are now just discussing the classification of ocular injuries. It is on 4 types: blunt injuries resulting from objects like fist or balls; penetrating injuries caused by sharp objects; perforating injuries, entry and exit wounds are present; chemical injuries from acids or alkalis. Okay, so these are the key points. Okay, just note down the key points and you can write the answers. Okay, blunt injuries, penetrating injuries, perforating injuries, and chemical injuries. These are 4 kinds of injuries. So classification of ocular injuries is a very important your exam question, and you should remember this kind of injuries. Okay. Now you can see the diagram on the right hand side. This is a common diagram for all the types of ocular injuries, not one specific type, but all the kinds of ocular injuries. Okay. So what does happen in the kind of if you get your eyes injured? So first of all, there can be tear of iris. First of all, there can be tear of iris. This is the iris. Okay, the iris has been teared. Foreign body. So this is a foreign body. A foreign body can enter your eyes. Okay, this is a foreign body. Foreign body can enter your eyes. Next, deep laceration of orbital margin. Laceration means you must have studied in FMT what is abrasion, what is laceration. Okay, so abrasion is just a clean incised wound. Okay, abrasion is just a clean incised wound, but laceration, that means it has a 3D component. Okay, so abrasion only has length and breadth. Abrasion only has length and breadth, but laceration has length, breadth, and depth. So it is kind of 2D and it is kind of 3D. So this is abrasion. I'm just telling you the difference between abrasion and laceration. Okay, abrasion and laceration. So laceration means that it is a deep component as well. So this is about the laceration, deep laceration of orbit margin. And this is distorted pupil. Your pupil will get distorted. There can be corneal laceration as well. Your cornea will get lacerated. There can be subconjunctival hemorrhage. That means the conjunctival vessels will burst. Okay, so there will be blood in the conjunctiva. So that is subconjunctival hemorrhage. You can get hyphema. Hyphema means collection of blood in the cornea. Hyphema means collection of blood in the cornea. Okay. Okay, so there is collection of blood in the cornea. Corneal abrasion. Corneal abrasion means cornea will get abrased. Okay, abrasion. I told you what is the difference between abrasion and laceration. So there can be corneal laceration as well as corneal abrasion. There can be lid laceration. You can see here the eyelids have become lacerated. The eyelids have become lacerated. This is the eyelids. Okay, so the lid laceration. So these are the important features. You can note it down. This can be written as a clinical features of ocular injuries. If somebody asks you or you get any questions of ocular injuries, you can write these points in the ocular injuries and you can just draw the diagram. I don't think that this diagram is very hard. Okay, you just have to make an eye and you just have to remember the points. Otherwise, you will be able to you have to just do the coloring. That's it. You don't have to do nothing. You don't have to remember much of the things. Like distorted pupil, you can draw any shape of distorted pupil. Corneal laceration, you can draw any shape of the corneal laceration. Deep laceration of orbit margin, you can draw any shape. Okay. So subconjunctival hemorrhage, you have to draw it in red color. Hyphema means collection of blood in the cornea. You will mention as if blood is flowing below the uh, in the lower portion of the cornea. Okay, there can be corneal aberration, there can be lid laceration, there can be tear of the iris, there can be foreign body. So just remember these points. Okay, or just or it would be better if you just draw this diagram. Okay. Okay. Now, what are the effect of blunt injuries on the eye? So, what are the blunt injuries? I told you blunt injuries means most commonly it happens with a fist or a ball. Okay, the examples are fist or a ball. So, blunt trauma can cause commercial retinae. Now, what is commercial retina? Commercial retina is retinal contusion. Contusion means collection of blood. Okay, if I tell you there is a brain contusion means there has been swelling of my soft tissue. Swelling of the soft tissue due to an attack. Okay, for example, I hit my brain with my fist. Okay, very strongly I hit my brain with the fist. What will happen? My brain will, my scalp will swell. Okay, not my brain, but the scalp will swell. Why does it happen? Because the soft tissue present over here gets the vessels present in the soft tissue will get burst and the collection of blood will be there. So there's retinal contusion. Okay, and there can be blackening. There can be blackening. Why this blackening? Because the blood will get accumulated over here. So there can be blackening as well. Okay, so the blunt trauma can cause commotio retinae. That means in the retina, the retinal vessels will burst. If the retinal vessels will burst, the retina will appear as retinal contusion. Okay, and it can lead to transient loss of vision. Transient loss of vision means for some period of time you will have a loss of vision, and for the other period of time you will not have any loss of vision. So this transient. Transient means for some period of time only. So that is about the commotio retinae. So this is the most important point. You can have commotio retinae or retinal contusion. This is the one point. Okay. Next is hyphema. I told you what is hyphema. Bleeding into the anterior chamber. Okay, that is a collection of blood. So where is the blood getting collected? Blood is getting collected in the anterior chamber, and it is common and can lead to the secondary glaucoma if not managed. We are going to discuss about secondary glaucoma in the upcoming live sessions. Okay, so don't worry about what is secondary glaucoma. Just remember that hyphema can lead to the secondary glaucoma if not managed. Okay, just remember this point. So blunt injuries can also lead to hyphema. What is hyphema? Bleeding into the anterior chamber. But you will see as if the blood is coming from the cornea. So we also refer it as accumulation of blood in the lower portion of the cornea. Okay, that is hyphema. Okay, bleeding into the anterior chamber. But since the blood is bleeding, the blood is bleeding in the anterior chamber, so blood will accumulate only in the lower portion. So if somebody asks you why the blood is accumulating only in the lower chamber and not in the upper side of your anterior chamber, because of the gravity, right? Because of the gravity, the blood will accumulate only in the lower chamber. So hyphema, if somebody asks you, hyphema, which is very common in blunt injuries, it only accumulates only in the lower portion, not in the upper portion. Okay, so hyphema is bleeding into the anterior chamber. You have to remember these 2 points. Hyphema, anterior chamber, right? Hyphema, anterior chamber. It is common. So this is about the second point. Now, third point, lens discoloration. Lens dislocation. Lens dislocation, the lens may be displaced from its normal position due to zonular rupture. Now, what is a zonules? For example, this is my cornea. I will draw. This is my cornea. This is my eyeball, right? Sorry, I'm not very good with the diagrams. Okay, I'll try to draw it very nicely. Okay, this is the cornea and this is my eyeball. Okay, now where is lens? Lens is placed over somewhat here. This is my lens. Okay, now lens are held by what? Lens are held by ciliary muscles. I will draw it with blue. This is the ciliary muscles. Okay, so the lens are held by the ciliary muscles. Okay, lens is attached by the ciliary muscles, and this ciliary muscles, just focus here. This part, I'm drawing it with purple. This part is zonules. Zonules. Okay, so if zonules will rupture, what will happen? If the zonules will rupture, what will happen? The lens will dislocate. Okay, the lens will dislocate from its normal position because it is the zonules that is responsible for holding the lens to its normal position. If there is zonular rupture, then what will happen? Lens will displace. And if the lens will displace, you cannot see the image very clearly. Okay, so that can happen in lens dislocation. Other effect, vitreous hemorrhage. You can also have vitreous hemorrhage. So this is the third point. This is the fourth point. Vitreous hemorrhage. Vitreous hemorrhage means there is vitreous tumor all over here. Vitreous hemorrhage means the vitreous, the vessels present over here will burst. So the blunt trauma can cause bleeding into the vitreous, leading to the vision obscuration. So there can be vision obscuration because there is bleeding in the vitreous humor. Okay, so just try to revise it with me. What are the effects of blunt injuries on the eye? This is a very important topic and can be asked as a short question separately or can be asked as a sub question in your long answer question. Okay, so but blunt injuries are very important. So you have to study the effects of blunt injuries on the eye. So first point, commotio retinae, that is retinal contusion. Second point, hyphema, bleeding into the anterior chamber. Third, lens dislocation. Why lens dislocation? Because of zonular rupture. Vitreous hemorrhage, that means bleeding of vessels in the vitreous humor, leading to the vision obscuration. 4 point, commotio retinae, hyphema, lens dislocation, vitreous hemorrhage. Try to remember this 4 point, and you can just draw the diagrams that I have drawn here. Okay, so for example, the diagram that I have drawn, It may look very untidy or very what I have drawn. But even if you draw this much only now, so the examiner gets the idea that you know what is lens, what is zonules, what is vitreous humor, what is cornea, what is eyeball. The examiner comes to know about everything that you have studied, right? So examiner just wants to know what you have studied and what you have remembered. Okay, he only wants to know that much only. So just try to present it in such a way that it looks very attractive to the examiner. Okay. Now, complication of blunt injuries, right? So, what are the complications of blunt injuries? Okay, you can see in the patient, blunt injuries can lead to retinal detachment. Okay, the retina can detach from the eyeball. They can be optic nerve damage, retinal detachment, optic nerve damage, and long-term complications like traumatic cataract or glaucoma. Okay, so I'll just write it down. Third is traumatic cataract. Fourth is glaucoma. So these are the four complications: retinal detachment, optic nerve damage, traumatic cataract, glaucoma. Cataract is somewhat related to the lens. Okay, and if the lens is getting displaced, that means you are going to have cataract. Glaucoma means something related to hyphema. Okay, so if you're going to having hyphema, that means you're going to have glaucoma. So if you are having any blunt injuries, okay, for example, your friend punched you very forcefully in your eyes. Okay, what will happen? You can get retinal detachment. You can have loss of vision. You can have your optic nerve damage. You can have your traumatic cataract, and even you also can have glaucoma. Okay, so there are the four complications that can happen. Okay, so retinal detachment, optic nerve damage, traumatic cataract, and glaucoma. Right, these are the four complications that blunt injuries can result in. Okay, so we have discussed about the classification of ocular injuries. We have discussed about the effect of blunt injuries. In that, we have discussed 4 points. Okay, try to remember the 4 points. What were the 4 points? Commercial retina. Second point, vitreous hemorrhage. Okay, third point, lens dislocation, and the fourth point, hyphema. Okay, and we have discussed 4 types of blunt injuries: retinal detachment, optic nerve damage, glaucoma, and cataract. These are the 4 complications of blunt injuries. Okay, so this was about the ocular injuries, right? Sorry, the classification of ocular injuries and the types of ocular injuries. Okay, now we are going to discuss about traumatic hyphae. What do you mean by traumatic hyphae? Okay, so traumatic hyphae means that hyphema, that means bleeding into the anterior chamber, and why it is bleeding? Due to some kind of trauma. You can see in this patient. Okay, what is happening in this patient? I'll draw it with yellow color. Just focus in the image. This. Okay, now I will erase this. Now just try to focus. Okay, can you see the difference? This is the accumulation of blood. You can see that it is happening in the cornea, but it is not in the cornea. It is in the anterior chamber. Okay, it is in the anterior chamber. So there's collection of blood in the anterior chamber. That is traumatic hyphae. That is hyphema. And traumatic means due to some trauma. Hyphema occurring due to some trauma. So definition: traumatic hyphema is the accumulation of blood in the anterior chamber following ocular trauma. Very simple definition. You will get 1 or 2 marks by simply writing the definition. Next thing, what you have to write? Next thing, you have to draw a diagram. What diagram you have to draw? Simply, you have to draw an eye. Okay, you have to draw. Sorry, you have to draw an eye. This is an eye. This is cornea. This is what? This is pupil. Okay. Now they're going to show about the accumulation of blood. So this is accumulation of blood. Just mention this as hyphema. Done. This is a diagram. Just do the eyelashes. Okay. Okay. Now this is a diagram you have to draw in your exams. Okay. So nobody's asking you to draw a very neat and clean diagram. You just have to draw a schematic diagram. The term schematic means everything is mentioned very properly. Okay. So that is schematic diagram. So traumatic hyphema means it is the accumulation of blood in the anterior chamber following ocular trauma. Now, clinical features include patients present with decreased vision. Okay, they can decrease vision, pain, and a visible fluid level in the anterior chamber. So there is visible fluid level. Okay, you can see here there is a visible fluid level in the anterior chamber. So patients present with decreased vision, pain, and visible fluid level in the anterior chamber. So these are the clinical features, right? How do you manage traumatic hyphoma? So conservative management includes the bed rest, okay, bed rest, head elevation, and topical steroids. Topical steroid means steroid eye drop. Okay, surgical intervention may be required if intraocular pressure increases. If the blood is getting accumulated too much in the anterior chamber, if the blood is if the blood is increasing in volume in the anterior chamber, that means you have to surgically intervene, and because the intraocular pressure is raising because of increased blood volume, and that may require surgery. Okay, so but conservative treatment, most of the time, it helps, and it gives best results. Okay, so you have to do bed rest, you have to do head elevation, and you have to do topical steroids. Bed rest, head elevation, and topical steroids. Okay, so these are the three kinds of management, and and the fourth kind of management is surgical intervention if intraocular pressure is raised. Okay, so we have discussed definition, we have discussed 3 to 4 types of clinical features, and we have discussed their management types. Okay, so this was about traumatic hyphema. What is hyphema? Hyphema is a very small topic. There's nothing much to learn in hyphema. You just have to know about what is hyphema and how does it happens. Okay. Now, what is traumatic cataract? We have discussed traumatic hyphema. Now, what is traumatic cataract? So, traumatic cataract, you can see in the image over here. Cataract, I told you cataract is something related to the lens. Okay, if the lens is getting displaced, or the lens is getting calcified, okay, that means you're going to have cataract. So you can see here, I'll just show it with the marker. This, you can see this. This is not normal. Okay, this is not normal. Our normal pupil is black, but here you can see some snowy appearance, whitish appearance. Why is this happening? Because there is the formation of cataract. Okay, trauma to the eyes can cause opacification of the lens. So lens has become opacified. Opacification means what? Opacification means it has become white. Some material has been deposited in the lens due to the trauma. Okay, so trauma to the eye can cause opacification of the lens. We have 2 terms, if you know, in the films we have 2 terms: opaque and radiolucent. Okay, opaque and radiolucent. So radiolucent means black and opaque means white. So opacification means whitish substance. Okay, so forming a cataract. So trauma to the eye can cause opacification of the lens, forming a cataract. So this is about the definition. Now the causes. What are the causes of traumatic cataract? Direct blunt trauma or penetrating injury may rupture the lens capsule, leading to the cataract formation. Okay, it may rupture the lens capsule, leading to the cataract formation. Now, how do you manage? How do you manage such condition? So surgical removal of the cataract, which is the process is known as phacoemulsification. This is a very important surgery that you perform in cataract. Okay, phacoemulsification. So phacoemulsification and IOL implantation, intraocular lens implantation. Phacoemulsification, intraocular lens implantation are the standard treatment. Okay, so what we do, we just remove the lens that has become opacified. We remove the lens and we implant a new lens. We implant a new lens that is intraocular lens that is of normal human power. Okay. Now it is sympathetic ophthalmitis. Okay, so sympathetic ophthalmitis means it is a rare bilateral granulomatous uveitis. Uveitis means uveal tract. Okay, the inflammation of the uveal tract that occurs after penetrating injury to the one eye. Okay, the condition arises. Okay, now first of all, let me tell you, there is a very rare and a bilateral disease. Okay, it is a very rare and a bilateral disease. It is a very rare and a bilateral disease, and it also results in the formation of granulomas. Okay, it can also result in the formation of granulomas. So it is responsible for infection of the uveal tract, uveitis. Okay, so what is uveitis? Mainly uveitis involves your ciliary muscles. Okay, I told you what is ciliary muscles. So uveitis mainly involves the ciliary muscles that occurs after the penetrating injury to the one eye. Okay, so it occurs to the one eye. Okay, just wait a minute. Okay, so uveitis means the infection has been spread to the one eye. Okay, Sorry, both the eyes. So in uveitis, both the eyes are involved. And what happens then? Okay. What happens that in the uveitis that occurs after penetrating injury to the one eye. If you get injury to the one eye, okay, if you get injury to the one eye, what will happen? Sympathetic ophthalmitis will result in both the eyes. Okay, but it is a very rare and rare condition, and it happens in bilateral granulomatous uveitis. So just let me first tell you what is uveitis. Uveitis, inflammation of uveal tract, meaning iris plus ciliary muscle. Okay, so it involves iris plus ciliary muscles. So ciliary muscles are what? This is example. Okay, this is our lens. So lens is held by ciliary muscles. So this is the ciliary muscles. So infection of this, why it will occur? Because they get penetrating injury to the eyes. For example, a pencil has penetrated in my eyes. Okay, if the pencil is penetrated in my eyes, what will happen? The ciliary muscles will get inflamed. Okay, ciliary muscles will be broken or will get inflamed. That will result in uveitis. Uveitis will result in the granuloma formation. Granular formation will result in, it will involve other eye also. Okay, so one eye involvement will result also in the other eye. For example, I got penetrating injury on my right eye, but the sympathetic ophthalmitis will result in both the eyes, not only just in my right eye. That is the special feature of sympathetic ophthalmitis, that it is bilateral. Okay, so the condition arises due to an autoimmune reaction against ocular antigens released from the injured eye. Now, why does it happens onto the other eye? Why does it happen onto the other eye? Because there is an autoimmune reaction against the ocular antigens that is based on the injured eye. In the injured eye, there after the injury, some ocular antigens are released. And the antigens travel to the other eye also. And onto the other eye, there is an autoimmune reaction that attacks its own cells, because the antigens are the body cells only. It is not from the outside. The antigens are the body cells only. Okay, so the antigens that is produced from the injured eye will get transferred to the other eye, and from the other eye, it will generate an autoimmune reaction, resulting in sympathetic ophthalmitis in that eye as well. Okay, so that is sympathetic ophthalmitis. Okay, so that is about sympathetic ophthalmitis, our definition and etiology. Okay, it is a very important condition. Okay, and I remember I also got a question of sympathetic ophthalmitis of 5 marks in my university exams. So I remember that you have to write first definition. Okay, then you have to write etiology, right? Then you have to mention clinical features. What are the clinical features? Patients typically present with bilateral decreased vision. There can be decreased vision because there's an infection of the ciliary muscles, and it will not hold the lens very properly. And if the lens is not in the correct place, that means you will be having disturbed vision or decreased vision. You will have photophobia. Pain on the eye on seeing the light. Okay, pain and redness. So these are the features: decreased vision, photophobia, pain, and redness. These are the features of sympathetic ophthalmitis. Okay. On examination, there's panuveitis. Panuveitis was inflammation of all layers of the uveal tract. Okay. Inflammation of all layers of the uveal tract with nodules on the iris. Panuveitis means inflammation of both iris and ciliary muscles. Okay. With nodules on the iris. Okay. So there's the nodules on the iris. Dallen-Fuchs nodules. It is also as Dallen-Fuchs nodules. Dallen-Fuchs nodules. So Dallen-Fuchs nodules are seen in sympathetic ophthalmitis. Okay, and it is present only in the iris. Okay, so the iris is present over here. So iris. In the iris, there will be formation of nodules. And what are these nodules? These are Dallen-Fuchs nodules. So these are clinical features. You will have decreased vision, you will have photophobia, you will have pain in your eyes, you will have redness surrounding your eyes. Okay, there will be panuveitis, and there will be Dallen-Fuchs nodules. You can see on the right hand side in the image, you will have mutton fat keratic precipitates. Okay, mutton fat keratic precipitates is also seen on examination. Okay, mutton fat keratic precipitates. Mutton fat keratic precipitates, it's very important. So these are mutton fat like substance. You can see here all the precipitates here. These are mutton fat keratic precipitates, right? And these are multifocal choroiditis. You can see here, This is choroiditis. That means inflammation of the choroid layer. Inflammation of the choroid layer of the eyeball. And eyeball is three layers: sclera, choroid, retina. Outermost is sclera, middle is choroid, innermost is retina. Okay, so the middle layer is getting inflamed. So you're having multifocal choroiditis. So that is one feature. So what are things that you study? Definition. Definition, what do you have to remember in definition? Rare, bilateral, granulomatous uveitis. That occurs after penetrating injury to one eye. Etiology, how does it happen in both the eyes, even if it is only one eye that is getting injured due to the autoimmune reaction. You have to remember autoimmune reaction. Okay. Clinical features: decreased vision, photophobia, pain, and redness. This is clinical features. Okay. And uveitis, also inflammation of all layers of the uveal tract, including iris and ciliary muscles, with nodules on the iris. And what are the nodules called as? Nodules are called as Dallen-Fuchs nodules. Okay. And you will also see metaemphatic precipitates with multifocal choroiditis. Right. So this was about the sympathetic ophthalmitis. Now, how do you treat this condition? So treatment is immediate treatment includes high-dose systemic corticosteroids. So we are not preferring topical corticosteroids. We are giving systemic corticosteroids